Hello, everybody. So I am here with some of our amazing and wonderful and fabulous Medical Health and Social Care Academy students from St. Mary's College. All of them are in year 13 and have been incredibly driven throughout the entire program. And we're here today to be able to hear some of their stories and share them with you. So if at the end of this you are interested in taking up a place at the Medical Health and Social Care Academy, we'd love to hear from you. And there's an email address located at the bottom of this slide to be able to help you with that. So you need to be able to email sm6apply@smchull.org. Or alternatively, tonight is our fabulous virtual open evening. So it's taking place starting at 6 o'clock tonight. You can pre-register at the email address located at the bottom, and you'll be able to virtually speak to any of the teachers running your subjects that you're interested in, or myself if you want to ask me specific questions about the Medical Health and Social Care Academy. So the first student I am going to introduce you to at this point in time is Lily. Lily, come and tell us about your story.
Hi, so I'm Lily. I want to be a doctor. I've applied for medicine at HIMSS, Leeds, Manchester and Sheffield. And I'm just going to talk you through some stuff that I've done in the Medical Academy and what I've learned from it. I joined the Medical Academy just because there's a lot of opportunities that it provides to students, and there's a lot of different things that they allow you to do and experience, which can help you decide your career, and it helped me decide what I wanted to do. I wanted to become a doctor because I love caring for people and I liked the challenge that medicine offered. And after I spoke to a doctor, he told me of all the benefits of medicine and how rewarding it was, which inspired me to pursue medicine over other healthcare careers. Through the Medical Academy, I've done loads of different stuff. My favourite was probably a mock PBL session I attended at Hull York Medical School. It was a 2-week thing and it showed me a key part of learning at med schools. It inspired me to work harder, to try and work harder to become a medical student and become a doctor. I even used the PBL session in my personal statement and I've used it in some of my interviews. All of the sessions offered by the Med Academy are really good in times where you can't get experience in hospital like now. You can talk about them and you can use them to try and further your application. The working lunch is really good because it allows you to speak to people of different medical professions and specialties, and that can inspire you, and it can also offer placement opportunities. Through the working lunches, I had already secured 2 placements through the Medical Academy, which would have been really useful if it was still key criteria, which it probably will be next year. You can meet lots of different doctors in different specialties, or even just healthcare workers, and you can just gain more experience from that. It can also help you decide which unis interest you. If you do a certain session and you decide that you like that style of teaching, it can lead you to focus on universities that focus on that. So if you like PBL, like HIMSS in Manchester. I think the lockdown and the current pandemic has shown that medicine is constantly changing and it will continue to change. So it's really highlighted the need for healthcare workers. More doctors and nurses are needed, which is why people should be encouraged to pursue a career in healthcare and join the Med Academy to help them find out what they want to do.
Amazing. Thanks so much, Lily. That was awesome. All right, so we have our next wonderful student, Kanga, here.
Hello, my name is Kanga.
So Kanga, what do you want today?
I want to be a clinical psychologist. Currently, I've applied to 2 courses in York. I applied to the integrated master's course for psychology and the bachelor's course. And I've also applied to Manchester, to Chester and Hull. I've always wanted to know more about psychology. I chose at A level, and it made me really interested into finding out more through the Medical Academy. I didn't particularly have a role model, which
Well, that's okay. So you joined the Medical Academy and you actually started with us in year 10. So tell me a little bit about that.
Well, I was part of it. It was a 4-week course where there were medical students from Hull University that came in, and they explained to us different parts of learning how to become a doctor, but also exposed us to a lot of different careers in the medical field that is not only a doctor, like physicians, different types of nursing, specific social work, and things like that. And does encourage me into looking further into who I want to be.
That's amazing. I'm really glad that you had that experience. So when you think about like going into psychology and you think about all of the opportunities that the Medical Academy has offered you since then, especially since you've joined sixth form, tell me about some of those.
Well, like Lily said, there are many working lunches that professionals and students come in from different universities and different backgrounds, and they tell you more about their own experiences and different professions, what everything involves. The Medical Academy also enables you to have a lot of volunteering experiences like placements or taking part in different campaigns and programs that are available. You get to hear a lot of different scenarios from the professionals that give you examples of what it's like to be in a certain career and what it includes. And personally, I've learned about many more careers that I've never even heard before. I've also learned more about the ones that I've already known about, like social work. And I've prior to entering medical academy, I thought social work was all about just helping children, and I learned that you can help adults as well. Same with different types of careers within psychology, which made me want to go into clinical psychology specifically.
Amazing. So what about lockdown?
So during lockdown, there were also working lunches, and although it was different, there was still loads of like helpful information that the professionals exposed us to. It also, aside from medical academy, I've realized that there are ways of doing things like independent learning that I thought would work for me, but they didn't end up working. So it was a really tough journey on finding out what actually works and lessening the burden of not having a teacher around 24/7 and creating space where I feel like I'm at home and not working all the time, since working in your bedroom and trying to wind down in your bedroom is different than working in the classroom and then coming back home.
That's really good. How has sixth form helped you with that? Because obviously there's some barriers or obstacles that you overcame, which is amazing. Congratulations. How did sixth form help you with that?
The teachers have been a big support because even though they're not there face to face with you, you can set up meetings with them. Same with the medical academy. If you have any like questions, you can email them at any point and they email you back straight away. They can set you up with a specific professional that you might want to ask more about if you're interested in a specific career. For example, there was a girl that came and gave a presentation about the York Uni, which is one of the courses that she applied, the Integrated Masters. She made me want to apply to that course as well because of all the things that she talked about, and the teachers gave me her email and I was able to get in touch with her and get more information about the uni and the course that I wouldn't know about if it wasn't for that meeting and presentation.
That's amazing. Awesome. Well done, Kinga. Congratulations. All right, so we have our next awesome student to be able to tell you her story, Esther. Esther, welcome.
Hi, my name is Hesper. I'm a medical healthcare ambassador, and I take A levels in biology, chemistry, and maths. And I'm just gonna go through a bit of background about me. So, being born and raised in Italy, I feel like I've had the privilege to see how the healthcare system changes from one country to the next. And well, I feel like they're quite similar in the sense that they both have a sort of centralized healthcare system. So how the England's got NHS, Italy's got something that's called SSN, which is translated to National Sanitary Service. And I feel like they're quite similar in that sense, but if there's something that I've found quite striking is the fact that, well, I feel like doctors in Italy and healthcare professionals in Italy see the patients in a way that it's more like a problem that needs to be solved. And I feel like in the NHS, I feel like doctors and nurses see patients more holistically, and they really look at the individual before thinking about the problem, which is something that I really appreciate. And I just thought, well, I feel like I want to give back to the NHS in that way, and it kind of made me think about pursuing a career in healthcare services. So I just did a bit of research on the NHS principles, and I feel like I kind of understood why the attitude and the approach to patients is like that in the NHS. And I feel like that's because of the main values and principles in the NHS, which are working together for patients, respect and dignity, commitment to quality care, compassion, again, that commitment to improving lives, and the fact that everyone counts regardless of age, sex, race. So while medicine, so I decided eventually that I wanted to pursue a career in medicine, and that's mainly because of the lifelong learning aspect of it, which is something that it's definitely something that I'm attracted to because I've always loved science, but I feel like I wanted to find a way to mix and integrate my love for science to my people's skills. So I decided that actually I wanted to do something in medicine, but the thing with medicine is that you never really stop learning even after you've done your undergraduate degree. While you're working, you're still learning every single day, and it's definitely something that I'm looking forward to. So I've applied for Holyoke Medical School, Brighton University, Leeds, and Leicester, and then Birmingham City University for biomedical science. So mainly you get 4 choices for medicine, and then you can get an extra one, which is totally your choice, and you can really choose whichever subject that you want to do. So I chose them. So being a part of Medical Health and Social Care Academy has really helped me decide what I really wanted to do and where I wanted to apply for. And that's mainly because of the working lunches. So what working lunches are is you get provided lunch, and then at school you get a health professional coming in and just talking about their profession, and it's really good because you get to hear about professionals that you wouldn't necessarily hear about before. So something that I found quite striking was last year. Hearing about speech therapy was something that I definitely didn't know about before, which was really useful. And just hearing about different career paths, something that I just think it clears up a lot, especially when you're quite uncertain about what you want to do in the future. And then another good thing about it is that you get a lot of career support, and with the career support you get to have a mentor. So I get to stay in touch with an oncologist, which is really good, and I just think it kind of expanded my knowledge on not only oncology or cancer study, but also palliative care and what really happens when a patient is terminally ill, which is something that I'm probably really interested about, and it's something that I'll probably pursue when I get into medicine. And the main thing with it is the extracurricular activities. And I think personally that extracurricular activities are absolutely vital when applying to medicine, because everyone's really going to have good predicted grades and good GCSEs and a good personal statement. But what's really going to make you stand apart from others is what you are as a person and what you did to get there. So the good thing about medical academy is that you get to, well, what I did personally, and probably my favorite part of it, is that we got to have a VR headset trial, and that was for one of the work experiences, GP shadowing, and it was really good because obviously with the current pandemic, I feel like we've had quite like restricted availability to like clinical work experience. So having that was really good. And you get to go to health expos and hear about different doctors and nurses and different health professionals, and you also get to go to GP placement as well. So that's again really good. So reflections on COVID and basically making the most out of it. Like I said before, I didn't honestly get much clinical work experience, but I feel like being part of medical academy made me reflect a lot on what I've done up until now. So it just made me really work hard during quarantine, just to get that little bit of something that I could talk about when I get to interviews and when I get to writing my personal statements. So I joined virtual summer schools, and I joined a summer school for Leicester and Holyoke Medical School. And again, if they are the uni that you want to apply for, I would always recommend look up for summer school or virtual summer schools that you can join before applying, so you can talk about them in future interviews. And I also joined the Green Club Society at my college, which is something that I would definitely wouldn't have done if it wasn't for the pandemic. I just think it really helps getting out of your comfort zone and just trying new things. And again, I became vice president for that. So again, it's really good to talk about in interviews and personal statement in terms of leadership skills.
Amazing. Thank you so much, Esther. That was absolutely brilliant. It's great to hear your story. So hopefully this video has helped to inspire you a little bit more to join the Medical Health and Social Care Academy or think about a career in health and social care like these awesome ladies are already doing. And we are sure that your futures are very bright and look forward to you guys joining the NHS soon.